So obviously COVID has had a significant impact on businesses this year. Talk to us a little bit about how you're seeing COVID impact maybe thoughts on healthcare in general moving forward and the benefits that companies are thinking about for their employees.
As you start to think about your open enrollment strategy and renewal process, communication is going to be key this year, especially with COVID. So utilizing technology like Zoom and Teams to host your open enrollments is going to be very important. But then also making sure that you have effective communication being sent to the home.
I think this year also is going to be critical to look at what your current providers are already offering. Things like ADP, Paychex, Paylocity are offering some open enrollment services, Jellyvision, seeing where you want to put your dollars to make sure your employees are able to make educated decisions.
Another thing that you should focus on is looking at 2021 and 2022. Because of all the deferred care and people not using the healthcare system, there's going to be a surge over the next 2 years. So what strategy and plan do you have in place to prepare for those years to come?
Think of it similar to saving for college. You know it's coming, so let's figure out how we're going to make sure that we're able to drive those risks down, teaching people how to shop their x-rays, shop their lab, shop their pharmacy.
What about in the renewal process? Are you seeing things from the providers on the pricing front or the available services and benefits front that are shifting as a result of COVID and what we've experienced this year?
Yeah, so for large employers that are self-funded, we've seen that their claims and costs have gone down because, again, people who deferred their care are not going to the hospital. For smaller, fully insured groups, we're projecting that most companies will see a decrease or flat renewals because, again, a lot of people aren't using their healthcare. And so right now, the insurance companies are making a lot of money from all of us. But what's important to start planning for is for 2021 and 2022.
I think it's important because of COVID, and to Andy's point, if those increases come, it's going to be even more important that you're not chasing the renewal, that you're able to preemptively budget for what you're looking at for 2021, 2022 to align with where you're expecting your business to go in that 3 to 5 year period.
Companies will save a little bit of money if people are moving off of their plans, but what it can do is it can disrupt the way the insurance carriers look at them. If they had, let's just say, for instance, an employer had 500 employees participating on a medical plan, but because of layoffs, they now only have 250 people. They're going to look at that business and look at their credibility and issue their renewal in a much different way. It could be an increase, it could be a decrease. So making sure that you work closely with your broker to understand what the impact is going to be because we have fewer people in the organization is going to be extremely important.
And potentially the employees that have stayed on may be mid-level management or upper management, and looking at that age band. They're going to be higher utilizers than you're entering workforce, your 26 invincibles. So that's going to be impactful on where your claims are going.
What about other benefits that you guys perhaps are seeing as a result of the shift here in 2020? Obviously, childcare is a really big topic and a lot on the minds of a lot of employees right now. Are you seeing any benefit shifts from employers to react to that pressure?
I think so. Prior to COVID, the big tickets for attracting and retaining were things like increased salaries, working from home options. Those were your big ticket items. If you had an employer that was offering a work from home option, that was offering large commuter benefits, so being able to offset some of the cost of taking, the trains in, that was a benefit. And they were looking at, kind of that being the ticker mark between which employer you may take if the salaries were fairly similar and positions were similar. Now you're just going to see a heck of a lot more of a focus on psychological medicine, or how many therapy visits are you covering? How many days off are you willing to give that are not work remote, that are actually just PTO days? And if you are requiring us to come into the office, are you partnering with a childcare facility? There's so many large, especially in the city, there's a lot of large conglomerate companies that can come together now and buy time and or spots for their employees in facilities that can drop off children. So let's say there's a Maryhill down the street and there's 5 large employers that have now purchased all the spots in this one Maryhill. If you're able to go to an employee that's looking at potentially working for your company and say, we can offer childcare to you. We already have the work from remote option. We do have incentivized PTO where you're actually not working from home. You're actually just off that day, because now you're seeing so many employees that are now working from home are working 45 hours, 60 hours, 70 hours a week because they're available to always be home online. Their phones are going off, their computers are right there, their tablets are right there. We need to focus a little bit more on the attract and retaining, being more focused on self-preservation. Are you doing the focus between family and work? Are you taking a break? Are you, where's your new kind of balance going to be?
The biggest trends we've seen is a focus on building a well-being program, not just a wellness program, but financial well-being, mental, emotional well-being, physical well-being. So we've seen a lot of employers, and we urge our clients to utilize their employee assistance programs, because employee assistance programs do a lot more than offer counseling to employees. They will help you find childcare. They can help you find ways to educate your children, help you find teachers.
It's not just childcare, it's also elderly care. You have parents at home that are now living with you because of things like COVID, or they're doing, multi-shares. EAPs are able to help with that too.
Yeah, that's a great point, and really consistent with what we're seeing from our clients as well. As we talk about financial wellness is such a buzzword, and in some respects we're seeing, and I think you guys are probably seeing the same. There's a whole onslaught of new products kind of rushing to fulfill this thing called financial wellness that we're not sure exactly what financial wellness is, how we measure it, and what we've suggested to clients is one of their first steps should be, hey, make sure you've got a really good inventory of what you've already got before you start adding new products to that suite, because you've probably already got a lot of really great tools available to employees that simply need some marketing and communication and a little bit of strategy behind them in order to then really have employees benefit from that.